And welcome to the Dr. Bob Show. Have you ever worried about having cancer? Most people do worry about that. We're getting better and better at diagnosing cancer and diagnosing it early and treating cancer with different options. We've got chemotherapy that we can use. We've got surgery, different types of surgery. We've got radiation, different types of radiation. Sometimes we can even watch. We'll be spending most of this show talking about treatment options for cancer. My guest is Dr. Ben Wilkinson. Dr. Wilkinson is board certified in radiation oncology, and he'll be answering our questions about different options that are available. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about what are causes of anemia? How do you know if you have anemia? Is anemia always bad? And a fever. Does it have a purpose? Could it really help you? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Ben Wilkinson, board certified radiology oncologist, medical director of Provision Cares Proton Therapy, and we're going to be talking about options that we have for certain types of cancer. Ben, welcome to the Dr. Bob Show.
Thank you for the invitation.
Tell me, what is a radiation oncologist?
So there's three types of physicians that treat cancer: surgeons, medical oncologists that do chemotherapy, and then radiation oncologists.
Is there one that's better than the other?
They all work together. So typically someone will see a surgeon first or maybe a medical oncologist, but it just depends on the type of cancer.
So it's a team approach.
Absolutely.
In general, the earlier you find cancer, the better the outcome in general?
Absolutely. That's why we believe in screening for some of the most common cancers like colorectal cancer or breast cancer, prostate cancer.
In this area, we hear a lot about prostate cancer. When somebody has prostate cancer and they come for a consultation because they've heard that Provision Proton Therapy is an option that they have, how do you handle that person that comes in for consultation?
Well, first, before a patient even arrives, we review their records and make sure that we have all the information that we need. A lot of times someone has started their journey with their primary care provider, and then they may have imaging or a biopsy result. So we collect that information and we'll do an intake review within our multidisciplinary team before a patient even comes on campus.
You say multidisciplinary team. What does that involve when you say that?
So there's an internal multidisciplinary team, which is the physicians as well as the physicists, dosimetrists that are involved in deciding if someone is a good candidate for proton therapy. But there's also physicians that we have on our campus that will come on site to evaluate from different disciplines. So surgery, medical oncology, radiology, pathology, GI physicians,
wow.
Breast cancer.
So you've gotten the records beforehand, and the person comes in and says, I've had the diagnosis of prostate cancer, and I want to hear what your opinion is on how I should get it treated.
Sure, and it's important to say that some patients even come in before they're diagnosed. They might have an elevated PSA or sometimes just a family history that they're concerned about.
Now, PSA would be a prostate-specific antigen.
It is.
That can be elevated in several different things, but if it's rising, we worry about prostate cancer.
We do, but it's important that the viewers know that when an elevated PSA is found, often by a primary care provider, it's most often not cancer. So definitely take a deep breath and know that it's typically going to be inflammation of the prostate or some other condition.
So that would certainly be good news. So back to the consultation, the patient comes in the room and says, I think I've got prostate cancer, my PSA is elevated, and what do you tell them?
So if they're pre-diagnosis, we talk through what could elevate their PSA and lead to a diagnosis of prostate cancer. Our preferred method would be obtaining an MRI to get the soft tissue delineation of the prostate to determine if we can see a cancer. If we can't, we'd go straight to a traditional biopsy. But if we can see a tumor, a lot of times we can do a focused biopsy just of the prostate cancer.
So you've got x-rays that you can get of the prostate gland, and you've got biopsies that you can take. And that gives you some tissue that gives you better education. How do you know if it's spread or not?
So one of the things that we do is we correlate between the grade of the cancer, so what it looks like under the microscope. The cells will either be loosely organized or packed in very tightly. Clearly, if a cancer is more tightly packed, that's a more aggressive cancer, kind of crowding their neighbors. And based on that and the PSA plus the physical exam gives us some probabilities of whether or not we're going to find cancer outside of the prostate.
So you get an idea of aggressiveness by looking under the microscope at the pathology, they said.
Right.
Do you have scoring of prostate cancers?
Yeah, Gleason score is the most commonly used system, and we will use a system, even though it goes from 2 to 10, it technically starts at 6. So a prostate cancer of 6 is typically one we can watch or potentially treat with great outcomes, whereas with Gleason 7 or higher, we know that we need to treat those.
So the lower the number, the better the sigh of relief, and the fact that maybe you don't have cancer even would be a sigh of relief. Greater than 7, it means we need to then decide more aggressively what we're going to do.
That's right.
So what are the options?
So there are many options in prostate cancer, and I think that's probably one of the frustrating parts of this particular cancer. In brain tumors and breast cancer, there's common agreement that there's a set way that we'll treat. But in prostate cancer, it's often based on the patient's preferences of the different side effects that can come with the different treatments. Surgery has some great benefits that you can remove the prostate very quickly, know whether it has worked or not. But there can be some of the mechanical side effects that can come from surgery. Whereas radiation, although it is an alternative, it does take more time for patients to come in on daily treatments. And so there are different forms of radiation that are shorter, some that are longer, and the side effects are potentially different.
Let's jump to proton therapy. What is proton therapy, and why is that an advantage in treating prostate cancer from a radiology oncology standpoint?
So proton therapy is a technology we've had here in the United States since 1990. Loma Linda opened the first hospital-based proton therapy.
Time.
It's been around for definitely a long time, and even in physics labs before that. But in a healthcare setting since 1990, and here in Knoxville, we have the 12th proton center in the country.
And we're very proud of that.
We are. Large centers around the large cities like Atlanta and Nashville do not have proton therapy at this point, so it's a blessing that we have this technology here in East Tennessee.
It's wonderful to have that available for the good people of East Tennessee and around this area. You get people from other areas of the country sometimes they come in?
We do. So we've had patients from 34 different states that have flown into Knoxville or driven into Knoxville, as well as 6 different countries that have come here for treatment.
So what's the advantage of proton or proton beam therapy versus just radiation versus something back of my mind, radiation seeds? What would radiation seeds be?
Yeah, so that's brachytherapy. So you can either implant seeds permanently, or you can do a temporary implant where we put the radiation in for a short period of time. But it all does the same thing. It attacks the DNA of the cancer cell, and it keeps the cancer cells from being able to divide.
The advantage of proton beam
is that it does not go all the way through the body. So if you think about an X-ray goes all the way through us. So when we're doing a chest X-ray, we want to do that. We want to see all the way through. But when I'm treating a cancer, I want the ability to be able to take the treatment to the cancer and then stop and not hurt any of the other tissues around it.
And proton therapy can direct the energy there and try and kill the cancer and not go into the surrounding tissue.
Especially the type of proton therapy we have here. We have the newest form called pencil beam scanning proton therapy, or PBS, and it's similar to a 3D printer. So if you've come across that before, it allows us to build someone's treatment one spot at a time.
So when you use the pencil beam proton therapy, how long is it? How do you decide what part of the prostate gland? How definitive do you get? How minute?
So we get down to 5 millimeters for the spot size of the pencil beam, and the accuracy is on the range of 1 to 2 millimeters. So we were able to focus in right on the tumor, but we often, just like surgery would treat the whole gland by removing the whole gland, we still give a moderate dose to the entire prostate. And then if we can see an area on MRI, we'll focus using the pencil beam and deliver a higher dose to that site.
How long does the treatment take?
It's about 15 minutes on the table. Patients are in the center for about 45 minutes each day, and they have a set time they come in, and it becomes part of their daily routine.
And we'll be talking about that when we come back. What is the routine? How long do you have to take that? It's just 15 minutes? Can you do it at lunchtime? Can you continue your normal activities and still have pencil beam proton therapy? You'll want to stay tuned. We're talking with Dr. Ben Wilkinson, board-certified radiology oncology. That's cancer radiation specialist. And it's been fascinating discussion about the ability of proton therapy to be able to treat cancers. We've been talking about prostate cancers, and we've been talking about proton therapy, pencil beam for that. Great discussion. Let's talk about, if a patient comes in, you said it would just be a 15-minute treatment. They have to come in, get ready, get positioned. So how frequently do they have to come, and what are some of the side effects?
So it depends on the cancer site. So the smaller the cancer is and the further away it is from important critical structures, as we say, or important structures in the body, we can use fewer number of treatments. So it's anywhere from 10 up to 40 different treatments that they'll come in for, so between 2 and 8 weeks.
So the important structures that are around the prostate gland would be?
The bladder, the rectum, and the bowel.
You have to be sure you avoid those, don't you? Is that one of the big advantages of proton beam, because you can hone right in on where you want and you don't have to worry about scattered radiation as much?
Yeah, so an X-ray is going to always have entrance and exit dose, whereas a proton beam, we come in at a lower dose, we deliver the treatment that we need to without any of the exit dose. So the low and intermediate dose that typically causes more of the side effects, we're able to eliminate that.
So the exit dose is what we're trying to get away from. Mm-hmm. The entrance dose that we have. How do you do that? What's the machine like? What's it look like? How sophisticated is it? It's big time.
Yeah, I mean, it looks like something out of Star Trek. That's what I think every day when I go to work. So you have the cyclotron, which generates the proton. You have a beam line that's guided by magnets. And I always encourage community members to come and do a tour. We do tours the third Saturday of every month, just to get to see this technology that's here. Hopefully something you're never going to need, but just knowing that it's an option.
Prior to this show, I took the time to go through and have a tour, and it was mind-boggling. It blew my mind. The sophistication is so good. So back to the patient, mm-hmm. prostate problem, mm-hmm. hasn't spread. You come in with pencil beam. Side effects would be what?
Irritation of the bladder or rectum are possible. The bottom side of the bladder and the front part of the rectum are still close to the prostate. So even though we're avoiding, the front 2/3 and the back 2/3 of the bladder and rectum, you still can get some side effects. So that could be going to the bathroom more often, urgency to go to the restroom, or discomfort going to the restroom.
How do you know how successful you've been, and what is the success rate?
So with prostate cancer, we're fortunate that we have a marker in the blood that we can check. So PSA goes up when you're diagnosed, and PSA comes down after you're treated. And if that PSA goes down close to 0 and stays in a flat rate, then we know that we've been successful. The rate of disease control for low-risk prostate cancer, 99%.
99%.
Intermediate, 94%. So very high rates of success.
That's big time. Is that a 5-year survival?
5-year, which is how we measure prostate cancer or cancers in general.
Can the patient do this and continue work, playing golf, go to the lake? Are they tired? Do they have fatigue?
So I think that's the best part of this, is that men can continue to do their normal treatment, or for that matter, kind of their normal lives. They can come in if they are working. They can do this either early in the morning or late in the evening. If they have other obligations, that they, a regular golf game, they can still meet those activities.
Let's talk about some other cancers. I did not realize that proton beam therapy could work for other types of cancer. And there's a a lot of different ones. So let's talk about breast. Is it effective for breast cancer, and is there any difference?
So it's important to say that any type of cancer that can be treated with regular radiation can also be treated with proton therapy. The only limitations we have are for very small tumors that move. So something that's right next to the muscle that helps us breathe, the diaphragm, those are a little bit trickier to treat with proton therapy, but we still have ways of doing it. So for breast cancer, we do have to treat the area that's on the chest wall. And what really helps with proton therapy is we're giving less dose to the heart.
And you had mentioned earlier, why is the heart so special when you're doing radiation therapy?
So radiation, one of the potential side effects down the road can be that blood vessels can become more narrow. The important blood vessel in the front part of the heart, the left anterior descending, or LAD, feeds the left ventricle, and that is the main pump that sends blood around our bodies. So that blood vessel is right in the path of a normal radiation beam. With proton therapy, we can bend the beam around the chest wall and avoid that, that vessel.
And you did that with magnets by guiding the beam?
That's one of the ways, but just the nature of the proton, because there's not an exit dose. So we can tell the computer deposit dose at the edge of the chest wall and then not to carry through the lung or through the heart.
So with the breast, do you go from different angles? Do you go straight ahead? How do you determine that?
Yeah, so we partner with our physicists and our dosimetrists, two very important parts of our team, and we come up with the best beam angles in one of the multidisciplinary meetings that I mentioned. But in general, with regular radiation, we'll have angles from the side because we don't want that scatter dose going through the body. With proton therapy, because there's no exit dose, we can actually bring a beam directly at a patient, and we can make sure that it doesn't go past where it needs to.
So other cancers that we can do, there's breast cancer. How about the esophagus? That's going right down the middle of the chest. Mm-hmm. It's fairly near the heart. Does that present problems, or how do you attack cancer of the esophagus? I didn't know you could do proton beam therapy for that.
Yeah, the conventional way that we treat esophagus cancer with radiation, which is one of the core ways that we treat esophageal cancer, is a beam from the front and a beam from the back with regular radiation. As you can imagine, that goes right through the heart. With proton therapy, we can treat the esophagus and minimize the dose to the heart.
How long would the treatment usually be, depending on the tumor size?
Roughly, it's about 10 minutes per beam. That's a good way to look at it. So maybe 15 to 20 minutes for most plans. But for really complex plans like a brain cancer or maybe a pediatric cancer, those can take a little bit longer. So
we're going to talk about brain cancers in a minute. Now we're breast, with the esophagus. How about the lung tumors, lung cancer? Where is the place of proton therapy for that?
So for really small tumors, we think that stereotactic body radiation therapy. Stereotactic body radiation therapy, or very focal radiation, even using a regular radiation machine is probably the best choice if someone's not a surgery candidate. But once you get above about 3 centimeters, which really isn't that large of a tumor, we start to see the benefit of proton therapy.
Can you get rid of the tumors? Do you see increased lifespan of these people? Do you see the cancer, quote, go away because of the proton therapy?
Absolutely. So when you treat these tumors, you can either see them shrink, turn into scar tissue, and sometimes they disappear entirely, which is always gratifying both for the patient and for the physician.
It must be unbelievable for somebody to say, I've got it, and then all of a sudden it seems to have gone away. Brain cancer.
So brain tumors are fairly uncommon, but we do see them here in East Tennessee. The primary brain tumors that we treat with proton therapy would be a glioma, like a GBM. We hear a lot about that because of Senator McCain right now, but also meningiomas, and there's other benign tumors that we treat as well.
And you do it the same basic way. You hone in the radiation where it doesn't have scattered, it doesn't go through the entire brain. You come in on one area and you concentrate the energy there.
There's so many important parts of the brain that are involved in daily function and short-term memory. So it's important to block radiation from those sites so that once someone survives a diagnosis of a brain tumor or another cancer like a head and neck cancer, that they can go on and still live their lives.
It's absolutely amazing. What I really like is the multidisciplinary. It's not just one doctor making the decision. It's a group together that says, this is best and this is the way we should approach. Does everybody agree? What angles do we use? I was just very, very impressed with the team approach and the wonderful disposition of the people that are caring for the people in this. You all have done a great job here in Knoxville, Tennessee, that scruffy little city. And I am so proud of what you all have done.
Well, Dr. Douglas has really been, Terry Douglas, as you know, has been central to forming this team, and the group that he's put together over the years, starting from developing the PET scan here to now proton therapy, has just been an amazing story.
Can you see anything in the future that will be any better?
So we hope that just making proton therapy more accessible. We're building proton therapy here in East Tennessee, so we have a factory out by the airport, and we're making proton therapy less expensive so mid-sized cities can install it. We're putting our first center in Nashville, and so that will open later this year, and then putting additional centers in Orlando, New Orleans, and then partnering with Duke University.
So wonderful for people in a society that are so afraid of cancer that now we have a treatment that can zap it away, is the way I would say it in lay terms. Ben Wilkinson, you're such a good teacher. Thank you so much for coming to the Dr. Bob Show. It gives me that sigh of relief that knowing when people hear scary information that there is hope and that we can get them better, and you're a big part of that.
Well, it's always important to talk about your options and hear the good features. Every case has good features, and that's what we emphasize.
Thank you. Will you come back again and teach us some more?
Absolutely. Appreciate it.
Wonderful information. That should make you feel better. Know that there are different options. Know that proton radiation pencil beam therapy may be for you and your loved ones, but they'll go through the options with you. You're going to want to stay tuned. We're going to be talking later on about anemia. What is anemia? Low blood count. Why do people get anemia? And what can they do about it? How can they recognize it? It's pretty easy, really, when you get down to it. And fever. A fever can be something that can help you. How is that? A lot of information. You'll want to stay tuned. I want to thank Dr. Ben Wilkinson. Wonderful discussion on proton beam therapy as treatment for cancer. And now questions from you, the viewer, that I think will be important to your health. Dr. Bob, my doctor says I have anemia. What does that mean, and is it dangerous? Well, anemia is low red blood cell count. There are several causes. One could be blood loss. One could be diseases that the red blood cells don't form properly. We can have vitamin deficiencies. Young babies can become anemic that are fed with bottles that used to not have iron supplements in them. So you get a chunky baby that ends up having anemia. The doctors will pick that up quick. Later on, the stress, bleeding ulcers, we can pick that up. Know if you've got tarry stools, black tarry stools, that's a sign either you're taking iron or that there's blood in the GI tract. It's usually from the upper GI. Sometimes dyspepsia, heartburn, acid indigestion can cause some bleeding. And when you get the anemia, the low blood count, you're short of breath. The red blood cells are what carry around oxygen to nourish the rest of the body. So we get short of breath, we get fatigued, we do things and we just can't do them because we don't feel good. And when you go to the doctor, he can spot the fact that your conjunctiva is pale, that your fingernails look pale, that your skin looks pale, and the doctor will pick that up quickly. You can look in the mirror and see if you think you look more pale than other people. If so, talk to your doctor about anemia. He can find the cause. He can appropriate the appropriate treatment for you to get that anemia to go away. And now, a question from the viewer also. Dr. Bob, is a fever always bad? It's a really good question. Sometimes a fever can really give us information of a disease process. So people that are having spiking fevers every day, 103, 104, maybe malaria every 3 to 4 days. We don't see that too much in the United States, but the way travel is now, people can get malaria. A sign of lymphoma can be spiking fevers. So why would a fever ever be good? Well, actually a fever can help kill certain bacteria. And so if bacteria are causing the fever, the body's response, then the fever can actually help the body get rid of the cause of that fever. So pay attention to your fever. Everybody should have a thermometer. Everybody should know what their temperature is. You can tell your doctor that. It'll help your doctor know what to look for. And he can get blood work that will help establish with the history where that fever originates, whether it's a sore throat or something going on in the abdomen or the joints or arthritis, numerous causes. But know that a fever can help you, and it also helps the doctor understand what's going on. All the time that we have, remember those 4 things that we like. Number 1, exercise. Can't tell you how important that is. Exercise just does about everything. It helps us lose weight, reduces stress, lowers our blood pressure, makes us feel better, get a runner's high. Get 7.5 hours sleep. If you're not sleeping well, know that there's a reason for that. People need their 7.5 hours sleep, and you don't need more or less as you get older. And if you're not getting 7.5, talk to your doctor about why that is and what you can do. Eat properly. Know that eating properly is a key to health. You sort of are what you eat. Be sure that you look at your plate. Be sure that you don't eat large quantities, that you include more fruits and more vegetables and less fried, greasy foods. It's pretty simple. We're pretty educated in society on the foods that are good for us. So pay attention to that. Pay attention to your diet. And then most of all, what is it we like? It's laughter. It's giggling. It does help your immune system. People around you will be happier. You'll be happier, and you'll live a better, longer life.